Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, July 30th, 2021, and this is our weekly COVID update. You know, it's been a pretty busy day, last 24 hours here at the health system. I want to thank the opportunity this morning to get on Carrie with Star Country to do a PSA this morning and just talk with him about what's going on with COVID in Northeast Texas. He's going to give us the opportunity to talk with him each Friday, and Dr. DeLisi is going to be talking with him on Tuesdays as well. So we appreciate Star Country and our local radio stations for helping us and getting the message out there and just keeping the conversation going. We also had an article written last night that we were a part of by the Daily Texan. They had interviewed us earlier this week with some of the increases in COVID across the state and really in South Texas, but in rural hospitals as well, and what rural hospitals are going for. Titus Regional Medical Center is one of the larger rural hospitals in Texas. We serve on the Texas Organization of Rural Community Hospitals Board, an executive board, and they had asked an article last night, so it was interesting to be a part of that and get feedback from other health systems to see they're having some of the same challenges that we're experiencing right now. And then a little surprise visitor around lunch today at Channel 7 from the Tyler Longview area showed up, and we had a good conversation with Bob Hallmark. We appreciate him. He's come several times to our area with the vaccines and COVID and just helping us out in different things. But we had enjoyed our conversation with him this morning to talk about COVID, to talk about it in Northeast Texas, in a small town, a community like Mount Pleasant and Titus County. You know, how does COVID impact us? So it's been a busy 24 hours. We've seen it. Want to get on the air this afternoon and just give the community an update of where we're at. From a numbers perspective, we believe the Delta variant is still rampant in Northeast Texas. This is highly transferable. This is highly contagious, high viral loads. We're seeing more of it. From a numbers perspective, we're sitting at 12 hospitalized per day. On Tuesday, when I went home, we had dropped down to 5. We had got up, and then we went into 4, and then 5, 6, and back at 5. Wednesday morning when I came in, we had jumped from 5 to 11 patients. And then from 11 patients to 13 midday yesterday, and by the end of the day, we were at 12. So, you know, it doesn't sound like a lot when I tell you we were at 29 patients last year at this same time, but 12 patients is a lot. Right now, from a staffing perspective, that's the biggest challenge that we have at Titus Regional. It's the same challenge hospitals around us are having as well. When I talk to my friends in my position in other places and CNOs, they're experiencing the same thing. And I talked this morning with the Rural Hospitals Board of Texas. Every board member is saying the exact same thing from a staffing shortage. We have the ability to have 29 COVID patients in this hospital if we're fully staffed. Right now, we're capped at 12. And when I tell you we got to 13, that means we're holding in our emergency department. So that's one of the challenges that we have. From a numbers perspective, you can see Northeast Texas, and this is the Paris, Sulphur Springs, Texarkana, Titus County area, where we went up for hospitalized patients from 83 to 124. Now, you notice the ICU patients, went up from 17 to about 35 as well. This is the first time we've seen that. And, that was a little concerning the last day, 24 hours, that we've seen that increase in sicker patients. With the Delta variant, we have not seen the ICU move much. And then all of a sudden, the last day or two, we've seen that ICU move up. So that means there's people out there, in my opinion, that have not got to the hospital, and it's just gotten sicker and sicker to a point where they're needing ICU level care. So it's very concerning from our perspective. I want to just mention, as we're dealing with this and the increase of hospitalizations and our emergency department hitting capacity, and then from a staffing standpoint, we have started doing treatments. And Titus has been on the cusp of using monoclonal antibodies. And Regeneron's the name of the medicine we give. And we gave it it's an outpatient drug that we gave during COVID. And not all health systems were doing it. We were pretty active in it, but we've been really active with the Delta variant, and we've seen it work. And it's an outpatient drug that we give. People come to the emergency department scheduled or the hospital for a scheduled outpatient, and they're given this antibody. And it helps them. It's ones who have contracted COVID but have not gotten sick from COVID yet, and we're able to do it. Not everybody's eligible, but patients of high risk, this has been a huge win for us. And we've given up to 6 or 7 the last few days each day. We didn't give that many at any time during COVID. So we're using everything we have. So our tool belt to fight COVID has quite a few things. And as an independent rural hospital, we make sure we have plenty of things to use, and we're using every tool we have right now. So I appreciate the staff and the medical staff and our nursing staff who are studying these these are state of the science and state of technology antibodies that we're giving out. So we're excited to offer that to our community. I want to say a thank you to my staff. The number of COVID patients that we can handle is going to be dependent on our staffing. And we've had our staff, our nurses, our respiratory therapists, our nurse assistants, our EMS, take on extra duties over the last few days. That's allowed us to go from 4 patients to 8 patients and to 12 patients. And we truly appreciate our staff. We appreciate our doctors who are working extra shifts to allow us to get more capacity to keep our patients in this community. At this point, we're not sure if we can transfer. So having enough staff, enough physicians on ready to go is what we need for this next fourth surge that we're dealing with. So I just want to thank you, my team members. They're going above and beyond, and I'm grateful to work with such a dedicated, selfless group of people, and it means a lot. I'm just telling you, they're a great bunch of people, and we truly appreciate them. From a testing standpoint, just want to make sure you know what we're seeing. Last week, and I'll update this Monday and send these numbers out, but you can see we're at 356 from a weekly basis. You can see these are tests that the hospital's doing. I don't care where you live. It's not a county thing or a city thing. This is just the test that we're giving on a weekly basis. And you can see over the last 3 weeks, we've gone 240, 262, then last week, 356. And our positivity rate increased above 18% with 64 positive. There's good and bad to that. I mean, to us, sitting almost a 20% positivity rate is scary. However, when I talk to my friends in other health systems, they're seeing positivity rates in the 35 and 40%. So a little concerning that we could get up to that as we start moving on, but this will be something that we keep sharing with our community. Vaccinations is what we're going to continue to encourage. You can see our vaccination rate at 39% for our region on 1 dose. Titus has moved up to 41%. So we're above the region average. And even our primary service area, I look at the 5 counties that we support and work closely with, you can see at 39%, which is the region's average. But again, we're way below the state's average, but I'm really excited about we're moving those numbers up. And we're almost fully vaccinated where the region is. And I looked over the next few weeks to get us above that. It's some things we have planned that we're trying to get out there. So we'll continue to encourage vaccines. You know, one of the things we talk about vaccines that I just want to share with you is I hear a lot of rumors, and people are texting me saying the hospital I have patients are always all vaccinated. That's not the case. Now, we talked about it last week, and I'll continue to talk about it. Vaccinated individuals are testing positive. However, over 95% of all hospitalizations in Texas have been unvaccinated individuals. That is something that we just need to understand. Vaccinated people can contract COVID-19. They are contagious. However, they're not getting near as sick as other unvaccinated individuals when you compare comorbidity to comorbidity. So, you know, there's been a lot of false and myths about vaccine, but that's the one thing we've seen, and it's consistent, not only in Northeast Texas, but in the rest of Texas, that the majority of our hospitalizations are unvaccinated individuals. So it's something I just put out there. I'm not telling people they have to get vaccinated. I won't make a political statement. I'm just telling you from a comorbidities and a high-risk standpoint, I'm going to encourage you, and our health system is going to take the stand that we encourage strongly vaccinations for everybody in Northeast Texas to help mitigate the spread of this disease. In order for vaccinations, we're keeping our clinic open, so I'd encourage you to go visit the team. They're open Monday through Thursday, 7:30 to 1:30. On Tuesdays at 7:30 to 7:30. They're open all day that day. There's no cost to this. We prefer you go to our website and get an appointment. It just makes it easier, so they make sure they have enough when you arrive and they don't have to thaw any out. But 7:30 to 7:30, 7:30 to 1:30, I'm encouraging you to get the vaccine. The more vaccinated we get close to a herd immunity, the closer we're going to be done to having this behind us. Masking is, it's one of those things that I just wanted to finish on today. And, I know it's a political subject, and a lot of people get mad at me for continuing to wear my mask. And when I go to the grocery store and I'm around people, but with this fourth surge upon us, I'm just going to encourage everybody to pull your mask out of your drawer. If you need masks, I've got them here at the hospital. Stop by and grab one at the front desk. And, again, I'm going to encourage you to wear your mask. It cannot hurt. I'm just saying from a masking standpoint, it's something that we individually, if you're against the vaccine, if you're strongly against it because of different reasons, I understand that. and I'm going to respect your choice from a healthcare standpoint. But from a masking standpoint, I'm asking everybody, vaccinated and unvaccinated, wear your mask because you care. You care about yourself, you care about your family, you care about this community. And I just reach out to each one of you and just say thank you for the ones who wear your mask and socially distance. Guys, we're in this together, and it's happening again. And we truly appreciate your prayers. We truly appreciate your support. And we look forward to continue to give these updates and keep the community apprised. We are starting back with some Facebook posts on the weekly testing and daily hospitalizations, and use that forum to ask questions. We want to make sure we get the myths out there and we get the right information from the right people to you. Thank you for your support of our health system. God bless.